At Arts Care, we have a team of 5 clown doctors, although we hope to have more in the future. They are trained actors, they've got artistic skills, clowning skills, and they use those skills in a range of health and social care environments, mainly working with children, but they can work with adults too, and working with staff and families. And we currently have Dr. Muddle, Dr. Clooless, Dr. Fizz, Dr. Dapper and Dr. Twinkle. They also work collaboratively with healthcare professionals, complementing the medical care being provided. They understand the importance of maintaining a respectful and sensitive approach, adapting their performances to suit the needs and conditions of each individual they encounter.
Hi, my name is Michelle Wiley and this is Amy. Amy has Aicardi syndrome and she has a lot of brain abnormalities. Amy first went into hospital at 3 weeks old from having a lot of seizures, and that's when we first met the clown doctors on a lovely rainy Tuesday, and yeah, they were great. They know how I feel about them. We've loved them for years, and one special time which I'll always remember is when Amy was on life support machine in intensive care. It was arranged that the clown doctors would come in there and sing to her. And it obviously has meant a lot to me. So.
Overall, Arts Care clown doctors play a valuable role in the healthcare system by using their artistic skills to bring happiness, comfort and a sense of normalcy to patients and their families, contributing to the overall well-being and recovery process.